Hello, guys and girls. The program you are about to hear will be both fun and educational, but it is not a substitute for medical advice. Although we are doctors, we are not your doctors.
Once upon a podcast dreary, while I researched, weak and weary, over many a medical theory, practiced once in days of yore, suddenly I heard a calling, as of something fiercely crawling from beneath the floorboards that weren't there moments before.
Look, okay.
Welcome to
These,
Travel Medicine Podcast. I'm Dr. J, your friendly neighborhood internal medicine doc.
oh God. Why
What's
why do
up,
you have
Santhosh?
to go to 11? Fine. Dr. Santhosh here, scared infectious disease doctor. Hi. Why?
What do
It's
you...
I'm so scared right now.
What's got your knickers in a twist?
Wouldn't it? No, you can't be all creepy and then just be like, "Oh, I wasn't creepy just then." That
Who's
was that
being
was
creepy? I do our standard intro, and you get upset. Dude, Santosh, I know that you're not like a horror movie fan, but just because it's October doesn't mean you have to be jumping at shadows.
oh God.
Anyway, home listeners, for those of you familiar with the show, we like to do little holiday theme events, and it's time for this year's annual spooky season episode. We're going to peruse through a couple different medical conditions that deal with, I don't know, existential horror, maybe just some body horror, a creature feature. Let's see what we pull out of the bag.
Oh God. Just
Maybe we'll chop a few of these stories up and mash them all together and make a sort of Frankenstein's podcast.
listeners, it's been close to a decade. We've been doing this, and I just every single time you have to get scarier and scarier, and all I want to do at the end of these episodes is go hide under my blankets.
Well, you might want to do that now because by the end of this episode, you may not be able to sleep. So let's get into this year's Halloween episode, A NightMed on Elm Street.
Oh,
Santosh, have you ever been to the top of a tall building or a
oh God.
cliff
Jeez.
and looked down? And,
Oh.
maybe you felt terrified, but maybe you also felt something else. A weird, inexplicable draw to jump.
Yeah. I thought that was is that vertigo? It's a creepy feeling. It's
Or
absolutely bad
maybe,
because it's something that absolutely should not be happening. That feeling, and it's happening.
or maybe you're just driving in traffic listening to our podcast, as one
Yeah.
does, and
Uh,
all of a sudden you feel an irresistible urge to jerk the wheel to the side.
oh God. Don't nobody do that. Don't You're talking about like catastrophic thinking, right? Like these weird impulses to do things that are completely the wrong thing.
Yeah, and it has a name in
Okay.
French, l'appel du vide, which
Okay.
is the call of the void.
Whoa. French. Getting
That's right.
creepy.
The language of love and cosmic horror.
Okay. The call of the void.
Yeah, so it's basically a fancy name for the kind of intrusive thoughts that a lot of our mental health population deals with. Now, this doesn't necessarily mean when you have these kinds of thoughts that you're suicidal or even necessarily depressed. It is your brain trying to organize and make patterns, and sometimes it just glitches. And you know what? we still don't have a real good reason for why this happens. And I'm going to leave that dangling there as we get into our actual horror. Why? Because I want you to sit there and feel uncomfortable with the knowledge that we offer not just answers, but sometimes mysteries. Why does
Yeah.
this happen? The world may never know.
I think it is fair to say, about just exactly what you said. Sometimes it glitches. That is absolutely true. It's a little creepy to think about, even in a different existential way, Josh, but our organic computer, our brains, are not perfect as they're firing, and you can have misfires, or sometimes some things which are like it would make perfect sense if we didn't live in our current technological age and all this kind of a thing with skyscrapers and, super fast cars and stuff. But it's kind of maladaptive to what we have evolved to have in between our ears. And yeah, it can get it's scary to think that we have fallible, possibly glitchy software, but we totally do.
And sometimes you need somebody to come along to study it. Someone who's a little unorthodox, maybe a little
Okay.
crazy, perhaps
Ah,
even a bit mad.
oh God, are we doing Frankenstein? We're gonna do Frankenstein.
Well, we're going to talk about some mad scientists, or at least some irritated ones.
Oh, okay. Sure, some upset scientists. Okay.
And let's open up with something that is, I think, on a lot of horror menus, which is, of course, electroconvulsive therapy, aka electroshock therapy.
Yeah, and I hope we get to talk a little bit during this episode about the good parts of electroshock because it's much maligned, but in fact, it is one of the most effective treatments for medication and therapy resistant depression.
Now, its distant history actually inspired Mary Shelley, as we've known that electricity can sort of galvanize even apparently dead cells, muscles, and nerves to act. And
Sure.
this was a science known as galvanism, and it is where Mary Shelley got the idea for lightning to animate Frankenstein. But
Ooh.
jumping forward a little bit ahead, ECT is often used in modern times as an intervention for major depressive disorder that is resistant to other treatments,
Hmm.
or mania or catatonia. Usually, it involves multiple administrations, typically given 2 to 3 times per week until the patient no longer has symptoms. Now, this is not like the electric chair. You don't just sit there and suffer until we shock the illness out of you. It's administered under anesthesia with a muscle relaxant. And there's three different ways that you can kind of change how it's applied. And that is where the electrodes are placed, the frequency of the treatment, and the electrical waveform of the stimulus. A little bit of a crank this puppy all the way up to 11. Ha 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 ha. But
No, 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 Josh,
no.
it's the opposite. You don't want to crank it to 11.
So, these treatment parameters can pose significant differences in both the side effects as well as symptoms going into remission in the treated patient. So, that's just kind of a very short intro about how electroshock is used today. But I want to give you a little bit of the history of it, and maybe history that you might not be familiar with.
Yeah, I know that it was thought of ever since we kind of harnessed electricity. Neurologists and other physicians actually were trying to figure out how it could apply to biology. And very early on, we understood that motor responses, so like our how our muscles work, are in fact electrochemical signals. So it made intuitive sense that you could likewise modulate neurology and your neurological impulses and using outside electricity. But I believe, Josh, that ECT had been found as a very good treatment for extreme depression, major depression, you tried medication, you tried therapy, nothing worked, and the person was, very ill, and you'd use it. But I think it was much maligned, especially in popular
Well,
culture, because it was
depression,
picture.
see, you're still thinking far too modern.
Oh, okay.
Depression came late to the game. Convulsive therapy was first introduced in 1934 by Hungarian neuropsychiatrist Ladislas J. Meduna, who believed that schizophrenia and epilepsy were antagonistic disorders, meaning you couldn't have one because it would preclude the other.
Oh,
So
that's an interesting thought. Okay.
So he would treat schizophrenia by inducing seizures with camphor and then metrazole. Two drugs I'm going to guess you haven't heard of because they're not really used at all anymore.
Well, camphor is, right? Because camphor is one of the, I think, petroleum products, but it's used nowadays for the little lamps underneath your heating pot.
This doctor would use camphor and then metrazole to induce seizures. And while even that story is a little bit creepy because metrazole, also known as PTZ, was formerly used as a circulatory and respiratory stimulant. It was found to be very effective for depression, but the side effects were uncontrolled seizures. So
Yeah.
this doc used the accidental side effect as an intended treatment. Now, let's jump ahead a couple years. In 1938, Ugo Cerletti, who had been using electric shocks to produce seizures in animal experiments at Sapienza University, came up with the idea of using electricity as a substitute for this drug metrazole in convulsive therapy. And for the very first time in 1938, used this therapy on a person affected by delusions.
Hallucinations and delusions, that kind of thing.
Yeah, false beliefs and
Right.
hallucinations.
Gotcha.
It was believed early on that giving someone who had severe schizophrenia a convulsion would help because, as we said, they thought schizophrenia and epilepsy were antagonistic disorders. Later, it was found to be most useful with depression. Cerletti noted a shock to the head produced seizures in dogs. The idea to use electroshock on humans came to Cerletti when he saw that pigs were given an electric shock before being butchered to put them into an anesthetized state.
Knock them out, essentially.
A positive side effect to the treatment they didn't know about till they did it on humans was retrograde amnesia. And it was because of this side effect that a lot of patients couldn't remember the treatments and therefore had no ill feelings toward it.
You've got anterograde amnesia, which is I can't make new memories, so I keep forgetting what I'm doing, in the present and the near future. Retrograde is the recent past. That's the standard, Gilligan's Island, the coconut bonks you on the top of your head kind of a thing. And they do it way exaggerated, right? Like you forget who you are and everything else like that. This is retrograde amnesia for, I think, just a few minutes to maybe maximum 1 hour, right, Josh?
Yeah. Oh, wait, you were going to shock me? You already did? Oh,
Yeah.
did I pay you? I didn't.
No. Nobody's going to do that. So the interesting thing here that you're bringing up, Josh, is that, and this is really important for everybody to understand, you are not using the electricity to shock the person and just to quote unquote fry areas. You're actually creating controlled seizures. And this is actually what causes the amnesia, as well as completes the therapy in in a person who's depressed. And it works beautifully well. But tell me, Josh, so what happened? He saw the amnesia. Where was the next steps that they took about using it for psychiatric disorders?
So, in the years 1947 to 57, following a turbulent retirement,
Okay. A turbulent retirement. He was forced out, I'm guessing. Is that the thing?
we'll just let you look that up.
Okay.
Cerletti invested his energies in a new project conceived as an extension of his original electroshock therapy research. And this is where we get into the mad scientist portion. Forced to leave the direction of the Sapienza University Clinic, he got
Aw.
funds from the National Research Council of Italy and founded a center for the study of the physiopathology of electroshock in Rome, which was aimed at studying liquid substances extracted from electroshocked animals' brains that he named acroagonine and injected into human patients. So he thought you can induce a seizure in an animal,
Okay.
collect its cerebrospinal fluid because it would produce some electroshock special post experienced liquid, and then inject that into people without having to shock them.
Oh, got you. Okay. So he thought that the chemical products of a seizure would be found in the cerebrospinal fluid. And so he was almost treating the seizure as if it was infectious. Like if it was transmitted to another individual, then likewise that other individual, because of the toxic byproducts in the CSF, they would seize. That's a little scary though, because there's no way to get those out then if that's how it actually works, which thank God it doesn't.
Didn't
Yeah.
stop him. And
Okay.
and he was inspired by similar literature at the time that believed the reason electroshock worked is that rather than inducing a seizure, it stimulated some kind of homeostatic process in the brain involving neuroendocrine response in the hypothalamic pituitary adrenal axis, which is kind of where all our hormones come from.
Yeah. Hypothalamus is kind of the big boss. Our pituitary is the master gland, which secretes hormones that help control a lot of our other endocrine organs. And then, of course, our adrenals, where the vast majority of our sympathetic responses come from, right? Adrenaline or epinephrine.
Now, this hypothesis proved ineffective, and then he
Oh,
began to further experiment, thinking that neuroendocrine effects of ECT would eventually lead to the development of the field of psychopharmacology. So, changing the way your brain works with drugs for
wow.
medicinal
Okay.
purposes. Um, so,
Okay.
not bad for a mad scientist who tried to bottle up the lightning, or at least the after effects of it.
Yeah. But that being said, I see how this mad slash disgruntled scientist kind of pushed forward our understanding of treatment of psychiatric disease. It should be said, it's an old therapy, but ECT now, especially that we can anesthetize people, and Josh, actually, we give them a paralytic as well, so they don't shake and bite and that kind of a thing. In fact, if you don't know, what you're looking at when you go in as an observer, it looks like absolutely nothing. It looks like the patient's just staying still, but the efficacy is so wonderful for people with major depressive disorder, especially with psychotic features. One of my favorite comedians, Josh, Gary Gulman, has talked about it in some of his specials. People should definitely go and watch that. But yes, do not look at One Flew Over the Cuckoo's Nest. That is not a proper characterization of this treatment.
Now, one of the things they'll do to make sure that to make sure that the seizure is working or traveling as intended is they'll monitor with something called an electroencephalogram or a brainwave monitor or an EEG.
Yeah. So if anybody's ever gotten an EKG where they've put the electrodes across your chest to measure the electrical activity in your heart, same exact principle, only the electrodes go over your scalp to measure the electrical activity going across your cerebral cortex.
But the idea of somebody just lying on a bed, unable to move, while to all outward appearances they're calm, but there's a lot of turbulence going on inside, kind of reminded me of one of my all time favorite horror movie series.
Oh God. Okay.
And that is, of course, Nightmare on Elm Street with the
Oh.
serial killing, wisecracking, master of the macabre and puns, Freddy Krueger. Now, one of the biggest things that anyone who's seen those movies know is the central tenet of that horror series is if you die in dreams, you die in real life.
Yeah. If you haven't seen it before, you want to start out with the very first movie, Nightmare on Elm Street, and the protagonist slash antagonist, I guess, the horror movie villain is a gentleman named Freddy Krueger, who, spoiler alert, but this is a really old film, chases you around and then actually appears in your nightmares. And if you fall asleep and he shows up in your nightmare, he kills you in your dreams and you die in real life. Creepy.
So, while we can say with reasonable certainty that dying in a dream does not absolutely result in real death,
Yeah.
the body does fling itself into fight or flight mode, which gives you a flood of adrenaline. So the heart beats faster, blood flows rerouted to major muscle groups. And in those who are already predisposed, that influx of adrenaline can cause a cardiac event, which could lead to death, which is a pretty ironic result from a process meant to keep us alive when sensing
Yeah.
danger.
Yeah. We are supposed to have in the deepest depths of dream state. So when we are, when we're really in REM sleep and we're dreaming and stage 4 and all those, we're supposed to have a pretty good rush of dopamine. Which, yes, it's the happy chemical, we think of it, but in this particular case, it actually works with other electrochemical signals to stop us from acting out our dreams. And this actually, there's a disorder where you can lack this, but you do actually decouple the autonomic nervous system to some extent, but not completely, which is kind of scary, Josh. So if you're having that dream where you're falling off the cliff and that kind of a thing, and you wake up, you will know immediately your pulse is going at 120 and you're sweating and you're breathing like
Well,
you've,
of course,
you
that's
know.
assuming you do wake up because one of the things they didn't put, one of
Yeah.
the things they neglected to mention in the credits for Nightmare on Elm Street is based on a true story.
Oh God. Oh, God, I really wanted to sleep tonight.
Wes Craven, creator of Freddy Krueger, said he was struck with inspiration for the Dream Killer when he read an article in the LA Times about a Cambodian family who came to America to escape mass genocide in the killing fields. They made it to the US. Everything was fine until the youngest boy in the family was terrified to sleep because he felt if he slept, he would be killed by something chasing him. He forced himself to stay awake for days at a time and eventually died in the middle of a nightmare, which is a very rough outline of the film Nightmare on Elm Street. But Craven told uh, interviewers that this wasn't the only article he saw. There were about 3 or 4 other articles about unexplained deaths of those from Southeast Asia, particularly Laos and Cambodia. And
Mm-hmm.
all of them were kind of eerily similar. So I started looking into this. And in 1981, the year of my birth,
Okay.
reports of sudden death during sleep began being reported, if not in mass, then certainly in way more than we would expect to the CDC. And the incidents
Oh.
seemed to be isolated to populations who had recently immigrated from Southeast Asia, in otherwise healthy individuals between the ages of 25 to 44 years old, and mostly men, all dying in their sleep. In total, 117 cases reported from 1981 to 1988.
Oh, jeez. That's so scary.
Oh, wait,
Uh,
let's make it creepier.
well, before you continue, when you say sudden unexplained death, so we're excluding those folks where it is clear after a medical exam and that kind of a thing, an autopsy, that this wasn't a case of sleep apnea where the person wasn't able to breathe or a heart attack or something like this, right?
None of these individuals had any prior history of cardiac events. None of
Okay.
them had family history. It was predominantly in Southeast Asia, and this kind of death during sleep is known as sunds, or sudden unexpected nocturnal death syndrome. Now,
Oh
of course,
gosh. Okay.
that's just what
So
we call it here. It has
yeah,
different
yeah.
names around the world, such as Bangungut in Philippines, Lai Tai in Thailand, Pokeri death syndrome in Japan because it has to sound cute, and suns in the United States and China. And despite these multiple different terms, which we'll get into, the common characteristics are the sudden death of young, healthy male individuals during nocturnal sleep with a post mortem autopsy that cannot explain their deaths.
Right. So we do have an analog, Josh, which is, it's not Freddy Krueger Nightmare on Elm Street, but we do have a syndrome called sudden infant death. And a lot like SUNS in adults, this definition does change over time because we do every now and again make inroads into discovering why, one child or another dies. We actually found that there were risk factors that we could modulate in SIDS, like smoking, for instance, not the kid, but the parent smoking.
Don't let your babies smoke.
Yeah. And then, oddly enough, when a child was put to sleep on their back, so actually, put on their back or maybe slightly onto their side rather than sleeping on their tummy, they were much less likely to succumb to SIDS. So there was maybe some factor of, actually smothering because the child, couldn't roll
Yeah,
out of the
well,
way. But
not here.
yeah. So
Just went to sleep, dropped dead.
yeah.
The mean age,
Okay.
33 years old, and
Sure.
75% were 25 to 44.
Uh-huh.
Gurgling, gasping, or labored respirations would appear in victims before death. None of them had a history of syncope, which is passing out, epilepsy, or allergies, and only one of 60 cases was confirmed to have a family history where it had happened to another member. Now, the very first time this is documented in the medical literature was 100 years ago, a little more now, in 1917 in the Philippines. And it was first described by Professor Maria Paz Mendoza Guazon using the Tagalog words bangungut, which is from bangun to rise and ungal to moan. Uh, and in the Philippines, they reported 96% of cases, males with an average age of 33 years, with a peak in December to January, and the mean time of death, the mode time of death was
Okay.
3 a.m.
Oh, wow. So just when you'd be at your very, very like outest kind of a thing.
or a
Uh,
deep in REM sleep.
right, right. So, when you're supposed to actually be by and large paralyzed, so to speak, and your mind should really just be going through the dream cycles, shouldn't be doing anything else really.
Um,
Which, by the way, that's quite complex in and of itself. But Josh, this was during dream time and stuff. So, God, are you going to tell me these folks how? I mean, they can't like tell us that they saw a guy in a fedora hat and a red striped shirt before they,
I mean,
kicked
we
off.
didn't see cases after 1988, and the 80s were kind of peak Freddy
But
time. So,
oh God,
but
oh
the
God.
word, so Lai Tai, which is the name of it in Thailand and Laos,
Hmm.
Lai in Laotian means a loud groan occurring during sleep or a noise made while frightened, and Tai is a word meaning death. So you have groaning sleep death. The mean
Okay.
age in Laos and Thailand was 38 years old, and the peak risk was about 45 to 49 years, so a little bit older. Most of the folks who suffered it were heavy laborers, like farmers or manual laborers, but earned low income, and there it occurred more in the hot season than any other. Uh, Now,
Oh, okay.
interestingly, SUNS is way more frequent in refugees and immigrants compared to the same ethnicities in their local homes. And most of the deaths from it occurred within the first 2 years after their immigration to the US, and declined rapidly after those peak mortality rates. So
Oh,
these are all
okay.
indications that maybe maladjustment to a new environment or separation from family, overwork, low income, and other stressors could be risk factors underlying it.
Okay.
But let's get into this. So, of course, the first thing most of our medically trained listeners are thinking is there's got to be some cardiac abnormality. So, researchers collected 18 hearts from these confirmed cases of SUNS, and they were reevaluated by Kirshner et al.
Okay.
They did see that about 17 of them had cardiac conduction system anomalies, and 14 of the hearts had persistent fetal dispersion of the atrioventricular node, which is our pacemaker node. Now, this could maybe explain some of the deaths, and cardiomegaly was also observed, meaning the heart was bigger than expected in a lot of
Okay.
these cases.
Sure.
They also, a different researching group, Nimonet et al., found that hypokalemic paralysis was prevalent in the same populations and geographical area, meaning low potassium and the inability to move muscles as a result, which most often tends to occur in the middle of the night or the early hours of the morning.
Oh, so this could have been, again, an electrochemical abnormality. So, generally speaking, and this is a big deal in internal medicine, I know, Josh, in the hospital, that if a person has low potassium, try to leave it alone as much as possible, because giving a person potassium, overshooting and getting high potassium, is actually very dangerous. But yeah, low potassium, you'll cramp up. On the extreme end of things, you'll actually, you won't be able to move. So, your diaphragm, which is a muscle, and your intercostal muscles, which help you breathe, were these getting kind of cramped up, and then there were conduction abnormalities in the heart? Is that moaning or groaning that they're talking about actually like a struggled breath because they couldn't actually breathe?
Well, the considering the risk factors that we've already gone over,
Yeah.
researchers were thinking that increased physical or mental stress, along with late night meals, excessive carbohydrates, could stimulate the shift of potassium into the cells at night, disturbing the homeostasis. Now, they also found a little bit of a conflation with night terrors, which is a sleep disorder that is characterized by, tell me if this sounds familiar, vocalizations and moans, clonic movements, meaning spastic movements, an unarousable state, and severe firing of the fight or flight neurons, which often were observed in Sun's cases before their deaths.
Yeah. So night terrors actually, they can happen as a normal part of aging. And the most common ages are between about 1 years old and 8 years old, as brains are changing during that period of time. Parents who have seen this, it scares the ever living crap out of them if they're not prepared, because it can be completely normal for a child. They sit up straight, Josh, their eyes are wide open, and they will sometimes make intelligible, speech and that kind of thing, but more often than not, it'll just be screaming, and they can't break the kid out of it. So there are times when they'll come into the emergency room, the family, they'll say, "Oh, my kid just had a seizure. Oh my god!" No, no, no. They had a night terror,
No, he
and
was just being tased by a demonic burned man in a
yeah,
fedora.
yeah. It's slightly abnormal, but not enough to call it a disorder or anything like that in children. But as the brains then mature past 7, 8, 9 years of age, these almost always go away and they get better, unless there is a neurological problem or a psychiatric trauma. So the idea that these folks who are suffering this are under extreme stress, from something like you're saying, like being supplanted from their homes and moving to a whole nother country, especially if they have a genetic predisposition for this kind of a thing, which it maybe sounds like with the problem with their potassium channels, then yeah, this could kill them.
And as we enter the age of genetics, a couple different genes were found as they went back and looked at some of these patients again. Uh, a
Ah.
mutation called SCN5A
Yeah.
was found to be very similar with another syndrome of random cardiac arrhythmias known as brugada syndrome. Now,
Yes.
both of these diseases were similar, not exactly the same, and they shared essentially a predisposition to ventricular tachycardia, meaning the larger lower chambers of the heart could start beating very fast in the absence of any structural abnormality. So the heart would look normal to a observer's eye when dead, but when pumping, it would go to town, just racing, but only the bottom part, which means your heart was beating an irregular rhythm between its top and lower halves, which meant that not enough blood or oxygenated blood was getting in or out to supply the body. That could absolutely cause sudden cardiac death and leave no trace behind. So,
Yeah.
EKGs of those who survived Sun's attacks was very similar to those who had Brugada syndrome. And in a follow up
Oh.
study on these Brugada families with genetics, a polymorphic ventricular tachycardia would occur or could be induced after large meals in foods rich in carbohydrates. Now, remember, what is a large part of the staple diet in Southeast Asia? Noodles or rice.
Okay. Gotcha.
Finally, fever, or a hot season, can cause the appearance of the Brugada EKG pattern and trigger episodes of ventricular tachycardia. This is not in conflict with SUNS, so it appears to be phenotypically a similar disorder as Brugada's, and we move from a burned fedora wielding knife-handed maniac to uh, large meals and hot temperatures in stressed individuals, leading to undetectable cardiac arrest.
That's so scary. So it's actually very topical as well, Josh. I know it sounds creepy. We did talk last football season actually about commotio cordis and sudden death in athletes. Well, we're now at a turning point where these rare events, sudden cardiac death, whether during a wakefulness or sleepiness, is now becoming a part of regular screening in our pediatric and some of our adult population as well, especially athletes. And checking, just a simple EKG can sometimes catch these patterns of arrhythmias, and taking a family history as well can sometimes find some of these. Unfortunately, some of these diseases, Josh, just like you said, the mutations happen spontaneously and you don't have any family history per se, the way that you'd expect to with a lot of genetic diseases. But this is creepy as all get out.
So, no way to know if
This
you
is
have it until you die.
until
Uh,
you. Oh, no, we're screening for it. We're screening for it.
but
Yeah,
let's
yeah.
say let's say that you are a dream warrior
Mhm.
and preparing to go do battle against Freddy, and it's
Yeah.
not Suns. Well, let's talk about some of the treatments for these night terrors or Freddy style nightmares. Just in
Oh, okay.
brief,
Sure,
there are
sure.
things like image rehearsal therapy, where you prepare for the nightmare, you talk yourself through these recurring nightmares, you kind of work out what's going to happen and how you want to handle it, and you do it over and over again. So when it does happen, you're on autopilot. So this is kind of a cognitive behavioral therapy, along with lucid dreaming, which is a variant of image rehearsal therapy, where it tries to teach you to alter the nightmare storyline by realizing one is dreaming or being lucid during the nightmare. That, of course, was the plot of Nightmare on Elm Street 3, The Dream Warriors.
Oh,
And
they decided to fight back by like taking charge of their dreams, that kind of thing.
yeah, they became lucid dreamers and had superpowers in their dreams that they used to fight off Freddy. And two
Oh,
randomized trials and one
okay.
case series showed
Yeah.
the efficacy of lucid dreaming in the treatment of nightmare disorders.
Oh, God. I thought you were going to tell us that randomized controlled trials showed the efficacy of lucid dreaming in fighting off Freddy.
So there was a randomized.
Like, all right. What's the placebo, Josh?
So there was
Oh,
a
God.
randomized trial that would evaluate lucid dreaming on nightmare frequency over 12 weeks in 23 people recruited from the general population who had nightmare disorders using DSM-4 criteria.
Okay.
And after they were trained in lucid dreaming, the frequency of their nightmares was significantly decreased in both individual and group therapy at 12-week follow-up. Now, one of the other things you see across a couple of Freddy movies is a drug meant to suppress sleep called hypnosil. Now,
Is this a fictional drug in
this
the
was
Freddy universe?
this is a completely fictional drug made up in the Freddy universe, although they did mention it could induce seizures, which kind of brings us back to that drug we talked about with Ugo Cerletti.
Okay,
Um,
gotcha.
but a number of medications have been studied for use in treatment of patients with nightmares. Most of them have been studied to assess their efficacy in the treatment of post traumatic stress disorder, or PTSD.
Okay,
And
gotcha.
the ones who have bad dreams that don't fulfill this criteria for nightmare disorders tend to be atypical antipsychotics like Zyprexa, olanzapine, things like that. But
Sure.
interestingly, there's been a surprising amount of success in treating nightmare disorders with clonidine, which is a drug we use for resistant blood pressure, but it is a adrenergic receptor agonist that suppresses your sympathetic nervous system. So it suppresses your fight or flight response and has been shown to alter REM sleep in a dose dependent manner. So,
Oh, okay.
clonidine is kind of the hypnosil of the real world.
Okay, okay. So lowers your blood pressure, but helps you fight sleep then?
Well,
Or
the
keeps
blood
you
pressure
awake?
thing is what we use it for now, but in
Right.
studies on PTSD, they said, oh, incidentally, it just stops you from having, or it decreases the amount of time you spend in REM sleep. Unlike another drug we've talked
Oh,
about a lot, which is quinine, used to treat malaria, that has a side effect of inducing nightmares.
right. So more than nightmares, people will say that it gives them extremely vivid, lifelike dreams that they can't separate from reality. A lot of the time, that is quite anxiety inducing. Like it's scary. But weirdly enough, Josh, some people have said they actually enjoy dreaming on quinine because as long as their dreams are pleasant, it's a lot of fun because it's like stepping into like a weird virtual reality world. But I love that. So you can try to use these therapies just like you talked to us before. So sleep dynamic therapy, lucid dreaming, cognitive behavioral. But if folks are unresponsive to this, then the other thing that you do is reduce the amount of REM time that they have, of actual dreaming time. So that makes a lot of sense that it can be used that way.
So, did a dream demon really emigrate from Southeast Asia to the US during the 1980s,
Oh God,
inspiring Wes
don't.
Craven? Or are people just dropping dead for no reason from cardiac things that can't be predicted? Which is scarier? I don't know.
Josh, my family immigrated here from Asia in the 70s. Did my
So,
mom and dad bring a demon? Oh God. I'm so scared right now.
let's move on to something a bit cheerier:
Yay.
voodoo.
Oh God, why? Are you gonna do zombies? Are you gonna do like the pain from sticking the needles into the creepy witch doctor who I
Do you
didn't
know?
tell
Do you know who?
was in love with you?
Do you know who the oldest practitioners of voodoo are?
Uh, I, I think I hope I'm remembering this properly. I believe that the practice comes from native peoples either of Africa, and the practices were brought over during the slave trade, or older world Haitians, one or the other. Native people who are in the Caribbean, in Hispaniola and Haiti. Am I
Well,
wrong?
you would be not entirely wrong, but perhaps I asked a misleading question because the answer is China.
Oh, oh, okay. That's an interesting one.
Now, it's
I
actually I should provide a little more context.
Yeah.
When we're talking about voodoo, traditionally you think of using a mannequin or a doll to induce an effect on a living person who is some distance away. Uh, China actually practiced reverse voodoo, and let's talk about this. This is fascinating. In Chinese
Yeah.
culture, modesty forbade a woman from undergoing a physical examination or even mentioning certain parts of her body to a male physician.
Oh, that's sad. Okay.
To circumvent this situation, during house calls, the doctor would bring along a diagnostic doll known as a mannequin or a doctor's lady.
Uh, okay. Okay. I kind of see where this is going. Okay.
He would hand the little doll through a curtain or a screen to the woman. She would
Okay.
then mark the section, giving her discomfort, and then hand it back to the doctor. So she would kind of practice reverse voodoo by taking her injuries, putting them onto the doll, and then giving them to which doctor?
No, stop it.
Uh, and this way, the woman could communicate her problems to the physician. Now, while both anatomical and diagnostic mannequins were similar in appearance, the anatomical ones were fashioned with a lot more detail. They could be produced in male and female pairs, but usually you saw the female figure and almost always in an advanced state of pregnancy. And that's really all we know about them because medical history, despite China's, you know, recorded history of record taking,
Yeah,
um,
yeah. It's so good. Yeah.
medical history contains very little to no information on the origin or intended use of the mannequins.
Oh, okay.
So this is all we know is that the doctors would carry these little dolls along and women would mark where they were injured and we don't know what they did with that information beyond what we would do today. Um,
Wow. Okay.
So historians kind of surmise that the models provided a means during the 17th and 18th centuries to study anatomy with a three-dimensional object or teach pelvic anatomy to midwives. But other competing studies said this didn't provide accurate enough information, and they were probably just used to educate the public on the differences between the sexes and physiology of pregnancy. But it's all just theory. So I'm going to
Okay.
go with Chinese voodoo.
The- You're saying this is what we're able to piece together from whatever records, and sometimes I'm guessing history that's passed down orally and this kind of a thing. So, just like you said, Josh, the Chinese history is very, very well documented by people in China. Like throughout, it's one of the best written histories that we have in the world. But I guess, they didn't really talk about these things, which seem to be quite prominent for, you're talking about, like 600 years.
Yeah. We just whole
Whoa.
chunk of history where we're like, these things existed,
Josh,
but why?
Josh, I wanna, I know we're gonna probably put a link in this kind of a thing, but I saw the picture. You said, like, this, like, the women are kind of positioned like laying down sideways in the, like, the Kate Winslet position in Titanic, like the draw me like one of your French ladies kind of a position, so that I it would be a little bit tough for them to even indicate, but I guess they're in kind of a posture of modesty. It's really interesting. Okay.
So There you go. There's a happy voodoo story. And the last one, Santosh, I saved especially for you to give you sweet dreams.
Oh God. Okay.
And it's about worms.
Oh dear. Okay.
Let's go back to Italy. We opened
I
with
mean,
an Italian. We'll close with an Italian.
we'll close with it. I mean, as you know, my study is in parasitology. I study toxoplasma, and by by the same token, I really love anything and everything having to do with eukaryotic pathogens, including worms. So, are we talking about these little worms inside of people, or like bigger worms, like earthworm-sized worms?
We're talking about corpse worms.
Cor-
Giovanni
okay,
Battista Grassi, one
okay,
of the greatest anatomists and highly educated doctors of his time.
okay,
Born in Italy in 1854,
sure.
he was a pioneer in parasitology. He was the one who discovered the life cycle of the tapeworm
Oh, okay,
and
cool.
the life cycle of the roundworm. He
Okay,
was also very involved in pest control for the viral parasite Phylloxera.
uh,
Now,
okay,
what you may not know is in order to understand and prove his theory about the roundworm Ascaris,
okay,
he ingested roundworm eggs that he had
sure.
collected from a human corpse after performing an autopsy.
Oh. Oh dear. That's that's a lot of trouble to go through. He could have like probably purified them out of the soil in his garden.
Nope, he was just digging through. He's like, I have a theory about worms, and he's sitting there doing his autopsy, and he becomes hungry. He becomes hungry in anatomy lab, as one does, and he looks at these worms, or at least these worm eggs, and he goes, I think those may have killed this guy,
Yeah.
and I know this because I'm doing an autopsy. But man, am I famished! And next thing you know, whoop, swallowed him.
Yeah, and so Ascaris lumbricoides is the one that we think about most of the time, and by and large, it looks like a little bit like a small pale earthworm. The adult one does, and the life cycle is a little bit complicated because in the external environment, it has to go through its egg and then hatch out, and then the egg has to be ingested, released into the bloodstream. It actually goes up into the lungs and you cough it up and you swallow it, and then the worms reproduce as not digest them, but as they go back through your digestive tract. So I guess at some point he had to he had to demonstrate this. So I'm guessing he found the larvae, which migrate and then get up to your lungs. I'm guessing he found those, and then the the eggs part in the intestines or something, where
The
they
worms
usually egg up
crawl
before
in,
you
the
fly.
worms crawl out, the worms play pinochle on your snout. They eat your
Well,
intestines, they scramble your heart. Now you feel like you're all apart. This is how it is to die. You end up looking like apple pie. Your brains come tumbling down your snout. Your eyes fall in and your teeth fall out.
yeah. It's a little creepier even than that, because Josh, in your intestines, right? The adult worms, so the larvae go to your lungs, you cough them up, you swallow them, they get through your, and then down in your intestines, the ascaris, before they make the eggs, they gotta, bow chicka wow wow right there in your lower intestinal tract before the female can lay the eggs.
The worms
So
crawl in, the worms crawl out. The worms have sexy time in your bowels.
exactly. Yeah, it's just a little creepy. So, yeah, so he was in the long and storied and honorable profession of self-experimentation, huh?
Honorable. After After the course of 22 days, he found out that he was also infected by
Yeah.
examining his stool, and he's like, "Hey, fresh roundworm eggs, just like I saw in that corpse. Something we haven't developed a treatment for yet. I'm sure this will go well."
Well, the truth of the matter is that at some time in our lives, if you look across all of humanities, about a sixth of us. So there's about 8 billion. So like 1 point something billion of us have roundworms going around, and by and large, they don't hurt you all that much. And
So look at your closest 5 friends, and
Yeah.
one of them is possessed by worms.
Not exactly like that, but yes, by and large, what they'll do, their parasitic lifestyles, is they'll just kind of hang out, and over time, because your immune system does a good job, it actually wipes out the worm burden. So this is mainly a problem for people who are very malnourished, little children, and immunocompromised. So he wasn't hurting himself all that much, in fact, Josh. But don't try it at home. Oh God. Oh, don't try it at home.
So that's it for this year's Spooktober
Why the hell
episode.
would he go into a corpse? He knew that you could find it in stool. You could just and it's zoonotic. It's everywhere in the soil. That's so
Santhosh,
creepy.
we've been over this. Anatomy lab makes you hungry.
So creepy.
That's it for this
Oh,
week. As always, we love to hear your comments, questions, and feedback. If you'd like to support us spiritually, emotionally, or financially, links to do that are in the show notes, along with links for further reading. And
I
trust
got
me, you want to do further reading.
I got hungry. I went out for pizza. Remember, you and I were there together. We just went out for pizza. It was
Yeah, after
gross.
handling corpses for an hour.
Well, yeah, but we didn't handle the corpses into our mouths. It was creepy.
Well, we're men of a modern age. So
Giovanni Battista Grassi.
our theme music is composed by Rachel Ledger. The show is produced by me with a lot of help from Dr. Santhosh and friends. If you'd like to find out more about our upcoming appearances or just get occasional love notes from Dr. Santhosh and I, go ahead and sign up for our mailing list at travelmedicinepodcast.com, and there may even be a special spooky surprise in it for you that may or may not talk about worms, murder, sausages, who knows.
I can feel them. I can feel them on me. This is so. Oh God.
But you're not thinking about dying in your sleep anymore, are you?
Oh God. I wasn't. Oh damn it. Oh God. Sweetie, I'm gonna be playing video games all night so I don't fall asleep when the Freddy Krueger kills me.
And
Oh God. Did you hear me?
as always, keep a song in your heart, soap on your hands, a shot in your arm, a spin on your globe, and hurry back.
Don't
Hurry
fall asleep.
back.
Don't fall asleep.
Be sure to bring your death certificate.
Oh God. Don't
And
fall asleep.
whether it's to this world or the next, as always, until next time, happy travels.
Bye.